So I'm going to drop a quiz in as people are logging on. They can take that quiz and we will get started right around 12:05. As we are waiting for everyone to join in, we are asking you to complete a quiz. So as you work on that quiz, we will give answers to that quiz here a little bit later. It should tell you the answer as you go. For those of you that may be watching this as a recording later, that quiz will be in the comment section of our YouTube channel. You'll be able to look at the questions and look at the correct answers in that quiz. So if you're not seeing the quiz because you're in that recording, it will be underneath of welcome in. As everyone's joining us, please take a moment to complete the quiz that's there. We will get started right around 12:05, so just about a minute and a half to go. We are looking forward to talking with you today. We're very excited that you are here. So far, that quiz is looking good. About 30 seconds here before we're going to get started with our presentation. So if you take a moment to finish that quiz up. We're looking forward to your answers, and we will get you those correct answers a little bit. All right, it's 12:05. I'll leave that quiz up for a little bit longer, and we are going to get started here. We are here to talk to you about empowering your patients through exercise. We are 2Unstoppable. And I've lost our slide there. Okay.
Yeah.
We're going to work today on the science behind the effects of exercise on cancer. We're going to talk a little bit about the research that's out there, the current guidelines, and how you can help your patients figure out how they're going to be exercising, and then how 2Unstoppable will play a role as a resource and a partner for you and your cancer center or hospital. We are 2Unstoppable, and I would like to introduce Ilana Gammerman to get us started with an introduction on who she is.
Okay. Hi, everybody. Once again, welcome. Whether you're joining us live or you're tuning in to us later, we're just so happy you're here, happy to spend this hour with you, and I'm happy to share, as Stacy said, just all the reasons why exercise is so important after a cancer diagnosis and how we can help you, help your patients get moving. I'm Ilana, and I'm one of the co-founders. And also you see on your screen, we have the lovely Charlene Crowley also joining us. Charlene is our community engagement coordinator. And anytime throughout this presentation, please feel free to put anything in the chat, anything in the Q&A. Charlene will be monitoring that, and we will definitely get to your questions. And we want to hear your questions for sure. And I'll let Stacy just do a little brief introduction of who she is, and we'll get going.
I am Stacy Mann. I am the fit instructor for 2Unstoppable, along with several other hats, working in the administrative part of the organization as well. My pride and joy of this organization is something we'll talk about a little bit later. It's our 2U Strong program. I love being a cancer exercise specialist, and I am so happy to be with 2Unstoppable, who is allowing me to continue to work with women who are on a cancer journey, anywhere on that journey. It's really an incredible experience to wake up every day empowering women through exercise, and we hope through this presentation we will give you ways to do that as well.
So before we dive into the presentation and exercise, just wanted to give just a little bit of just a little bit about how even 2Unstoppable was founded, and then we'll go into the presentation. So in 2017, that's when 2Unstoppable was founded as a nonprofit by myself and a friend of mine. We both had breast cancer. We both were committed to exercise during that whole time in our lives, from diagnosis through treatment till today. And we both benefited from the support that we received from each other to keep moving throughout that time. And that was really the inspiration behind us founding this organization. And since 2017, we have been working to help women with any kind of cancer, any stage of cancer, to keep moving. Just thrilled for the opportunity, and we're just constantly as an organization are working to help women, no matter where they are in the country, to keep moving and to improve their quality of life through exercise.
So what we know about exercise in cancer, oncology exercise is becoming more and more important as we are doing more research, more studies on the effects of exercise within after diagnosis, throughout treatment, and well into survivorship. So we have compiled a few studies here. There is way too much research to be put onto one slide or in one presentation. And that's new. That's really only in the last, it's maybe started in the early 2000s, but since 2020, there have been even more studies done that are showing that it lowers recurrence risk, it improves that psychological and physiological health, and even small amounts, small bouts of exercise work really well, are very effective. So you're seeing something here called exercise snacks. That is one of my favorite terms to use. It breaks up what is a guideline of 150 minutes per week of moderate to vigorous cardio activity. Your first question there in the quiz, as well as 2 times per week for strength training. So that's your answer in that first part of the quiz. But here you can take exercise snacks and you can make them work for you. This is less than 5 minutes of vigorous exercise was associated with a 20 to 21% reduction in total cancer risk, but also has an effect when you currently have cancer. It is creating more immune cells, being able to go through the body, those natural killer cells. You can see that it also, exercise has been shown to suppress cancer or tumor growth. So we're having a positive effect on the angiogenesis and stabilizing tumor growth, if not suppressing it. Super important just to even take a walk during treatment. This is a fantastic graphic here. Pretty busy on the page. However, if you take a look at it and you boil it down, you can see that what we are talking about is this effect of moving. It's decreasing the effect of cardiac toxicity. We are increasing brain function, so that cognitive decline, that brain fog feeling from chemotherapy, radiation is not felt as much. We're reducing chronic fatigue through exercise. We are reducing cancer risks overall for the generally healthy population. We are also reducing risks of recurrences. We are seeing that we have an infiltration of immune cells when you are adding in that 150 minutes of cardio activity per week, which breaks down to about a little less than 22 minutes per day. You are increasing these curative effects of that cancer treatment. You're inhibiting cancer cell proliferation. It's not able to necessarily break through barriers anymore when you have this effective exercise going on. You're regulating that cancer metabolism. And of course, you're designing the body's environment to fight cancer more efficiently. Even in metastatic disease, we're seeing scientific research being done that is showing that we are preventing tumor spread around the body through moderate intensity exercise. That is working at about 50% of your max heart rate. You're again showing that slowing of tumor growth, even in metastatic disease. And you have the timing, again, these small bouts of activity adding up to hopefully 150 minutes per week. It could be 10 minutes a day in the morning and then 10 minutes in the evening. It actually works, and especially bouts of acute exercise. So building up to 6 to 8 weeks of exercise continuously, and then hopefully making that a lifelong habit. Making progressive exercise a key factor, building slowly as tolerated to the body, moving through exercise as you get stronger, adding a little more resistance, adding a little bit more time to your walks. It has definitely been shown to decrease the effects of treatment as well as slow that tumor growth. Super important. It's what we're after with all those treatments. There are a lot of guidelines out there. When studies have been done on this, you may recognize that 150 minutes per week of moderate to vigorous activity and 2 times a week for strength training as the guidelines that are out there for all Americans, all humans. However, in cancer, it is shown to be the same. They are saying that you have reduced fatigue with 12 to 15 reps, 2 sets of strength training, 2 times per week. So working up to that 30 repetitions total, and walking for 30 minutes a day, having moderate intensity exercise, that cancer-related fatigue. Again, just backing up what we're saying is actually working. It's working on anxiety. It's working on depression. Lymphedema has been shown with supervised strength training for major muscle groups. It is showing to reduce that risk of lymphedema and drain the lymphatic fluid so that people with lymphedema have a better outcome, are not feeling as swollen, and the lymphatic system is able to drain a little bit more. It's acting as a pump for that system. The effects on bone health, definitely that moderate to vigorous resistance training, working on that time under tension, the bones under tension as you're working through strength training. And of course, sleep. A common complaint is inability to sleep. Moderate to vigorous cardio activity has been shown to be helping with sleep. So we're working our way through these guidelines. You can see that it is also recommended by the American Cancer Society to take part in regular physical activity to avoid that inactivity. And there's that 150 minutes per week number again. We are also wanting to include strength training exercises at least 2 times a week. This isn't major weight. We're not talking about adding, 15, 20, 30 pounds to a bicep curl. We're talking about lifting a water bottle maybe to do a bicep curl, using a resistance band. Any of these things, as tolerated, are definitely adding that time under tension, increasing that bone health, and increasing the strength, and making the patient feel a lot better. The American Society for Clinical Oncology is also recommending regular aerobic exercise and resistance during active treatment with curative intent. A really big guideline that was released this January 24, is the National Accreditation Program for Breast Cancer Standards. So a lot of breast centers fall under this accreditation program, and its point in its guideline was to say that in order to stay accredited, you must be referring to local or online exercise programs to ensure that breast cancer survivors receive referrals to exercise programs at follow-up appointments. You are the trusted professional. Patients are looking to you to say, what should I do? How can I increase my chances of surviving? How can I decrease my risk of recurrence? How can I move through this? How can I not feel as tired and become more energetic and get back to my daily routines? These guidelines are saying, okay, it's okay to refer them to exercise, to have a trusted program to refer them to. A more recent study that has come out has talked about the loneliness factor and how lonely you can feel within a cancer diagnosis throughout treatment, particularly women who were diagnosed at the time of the pandemic and are now coming out of it and working through finding, maybe they're now in survivorship, maybe they are metastatic, but they're finding it even a little bit more lonely. They had to go through treatments by themselves. And this is associated with a higher risk of mortality. So bringing a social connection aspect to fitness is extremely important. So not only are you getting the benefits of exercise, but hopefully you're going to get that social connection there as well, increasing that lifespan. Any questions so far? So a good idea to go through is this quiz that we had you do, and I'm going to end it here in a moment. So as we talked about already, that first question, what are the recommended physical activity guidelines for cancer patients? It is that second answer, that 150 minutes per week of moderate to vigorous cardio activity and 2 times per week of strength training. Moderate to vigorous being what is working for that individual, what gets their heart rate up a little bit more, right? What percentage of patients get the recommended amount of physical activity? That last answer is the correct one. 4%, 96% of cancer survivors and people living with cancer are not getting that recommended amount of physical activity. The best form of exercise and one that can be recommended during and after any treatment, including surgeries, walking. Even if that is just walking from the hospital bed to the bathroom or out in the hallway, it is so important to get up and get moving. Although we all do like couch surfing a bit. That fourth question there, patients with metastatic disease shouldn't exercise, true or false? Congratulations, you got that right. That is false. They absolutely should be exercising. What is a cancer exercise specialist? Everyone got that right as well. It is that first one. We are fitness professionals who have studied to become certified with either the Cancer Exercise Training Institute or the Academy of Sports Medicine. And then we have a deep understanding of over 30 different types of cancer, their treatments, effects, surgeries. And we have to recertify every 2 years. The most common barriers to exercise are, again, yes, all of the above. We see it all the time. So congratulations on finishing that quiz. Can share those results there for just a second before we move on. There we go. All right, so how can you help your patients get moving? We can just review what we just talked about, right? You're gonna say that this exercise is medicine. It is going to work for you. It is probably one of the great forms of medicine. So it's fundamentally therapeutic treatment in the management of cancer, absolutely. Improving range of motion after surgeries, whether it's in the lower extremities, upper extremities, abdominal area, you're going to improve that range of motion throughout the body, combating that joint mobility, flexibility. Sometimes we get very stiff from pharmaceuticals. Exercise can definitely help. Improving balance, absolutely. The neuropathy is a problem, and working on balance can definitely help. Preventing muscle wasting, and of course, lowering the risk of heart disease and fighting fatigue. Again, there's that walking for 20 minutes a day. And I'm going to turn that over to Ilana.
Wow, as much as I hear this all the time, just every time I hear about the benefits of exercise, it's just sort of like, wow. Exercise is truly medicine. And just to sort of summarize everything that Stacy went over, there really is an effort throughout the country, in a sense, even the world, but the exercise oncology researchers out there are really working hard to have exercise be part of routine cancer treatment. So exercise is prescribed just as a patient is prescribed chemo, radiation, surgery, that exercise is right in there and is part of treatment at time of diagnosis, because it's so important. There's so many wonderful quotes out there about exercise, and you might have heard them too, but truly, if exercise was a pill, it would be prescribed to every cancer patient worldwide. And exercise really changes what is going on in our body, from that kind of busy slide that Stacy shared, but it's really changing what's going on inside and is making it making our bodies a less susceptible environment for cancer to grow. So so important. It's if we take almost every side effect of cancer, exercise comes in to lessen, mitigate that side effect, whether it's, the joints, whether it's sleep, whether it's, worry and anxiety, all the cancer treatments that can affect our, muscles, affect our heart. Exercise is the medicine to help combat all those treatment side effects. And knowledge is power. And the important thing for clinical providers is a lot of times patients really don't know. They don't know how important exercise is, especially after their cancer diagnosis. It's one of the most important things they can do for themselves after cancer, after its treatments, to help sort of build their bodies up again. Exercise is the answer. And as Stacy also says, doesn't have to be big. It's those little small exercise snacks. So I kind of just alluded to that. So here's the really sad part. So many benefits to exercise, and only 4% of people are getting the recommended from from the American Cancer Society, all the other guidelines, getting the recommended amount of exercise, which is really sad, and really where we all can come in and try and help. But there are true barriers to exercise. Somebody might be at their doctor's office and they might be complaining of all the different side effects. And the doctor or even the nurse might say, well, you got to try and exercise. You got to try and build some exercise. You've got to try and do X, Y, or Z. And that patient really doesn't know what to do. They don't know how to get started. They're afraid. They're not comfortable going, let's say, to a gym. They're afraid because they have side effects, and they are afraid, well, is this exercise going to cause me to have lymphedema? Is it going to exacerbate my lymphedema? Does this, let's say, trainer know that I had surgery and I need to be careful of my range of motion, or how to give me modifications to exercises because of post-op and what I'm dealing with? So there's a lot of confusion. I want to get started, but I don't know how. And then it's the all too, I don't know what to do, and they want to do it, but they are not motivated. So that's where a lot of that social support needs to come in. Somebody, a buddy, somebody who gets it, somebody who can together can help them to keep moving, like me and my friend did about 10, 12 years ago while we were going through cancer. We were each other's buddies to help ourselves get moving. And again, there's so much going on after with a cancer diagnosis, whether it's barriers as far as how do I get to, let's say, a gym, or how do I get to an accredited cancer exercise program if it's not in my area, or it's too far for me to get to. There are true barriers of family, work, pressures where oftentimes the patient is putting herself last. So there are so many barriers to start exercising, but there is also a lot of ways that we can help people get moving. Slide. Okay, so again, we've talked a little bit about some ways that you can help. And it's not even about necessarily, and we'll talk about how 2Unstoppable can help in a little, but sometimes it's really even in the office or as you're working with a patient, sometimes it's taking away those stereotypes of what exercise needs to be. It doesn't mean we got to carve out an hour in our day to exercise. It doesn't mean I've got to take this class and really exercise really hard, because now that's really going to count as exercise. Exercise can really be anything that gives you joy. If it's spending time gardening and you're in your yard, if it's putting on some music and dancing in your room for 5 minutes to some good music, if it's taking 3 walks a day that are just 5 minutes each, all of a sudden you've got 15 minutes. There's been studies that show 2 minutes of exercise adds up. So it's really helping your patients understand that exercise doesn't have to be this big thing, that it can be really small. It can be those exercise snacks. It could be a small walk. It could be while they're cooking in the kitchen and doing some little bit of strength exercises while they're doing something. It's those incidental kinds of exercise, parking a little farther away and walking into a store. Whenever I get on the phone, I often just walk outside and walk and talk. So there's so many ways that we can sort of take away some of those stereotypes for our patients so they can feel better that, yeah, I'm going to give myself credit because I walked 5 minutes today, and then I did 10 minutes the next day, and slowly building that up. And again, and then refer, we'll tell you a little bit more about what we do, but knowing some places that you can refer your patients to where they can get safe and effective instruction can certainly help.
And just to finish off this slide, as we're moving into the next slide, I'm going to launch a little poll here. We want to know, how often are you referring exercise as treatment? So take a moment and look at that, and we'll move on to the next slide. So as you're looking at that poll and we are finding out how often you are referring your patients out to exercise or prescribing exercise to them, talking to them about exercise, we want to talk to you a little bit about 2Unstoppable as a resource and a partner. Ilana, would you like to talk about our vision? I think that's important.
Sure, I'm going to just minimize the quiz here. So, 2Unstoppable, help every woman with a cancer diagnosis access the tools and support she needs to help her get moving. And that is truly what we're all about. We are not about, saying, okay, you've got to do 150 minutes today, and you've got to do this, and you've got to do that. We are about helping every woman that sort of reaches out to us, seeing where she is and helping her really get started. If it's just by some education, maybe she's watching one of our webinars or reads something on our website, or maybe she reads a blog on our website and that gives her that motivation. That gives her why to get moving, then that's wonderful as well. But what we've kind of cultivated at 2Unstoppable over the years is 4 aspects to our organization that really makes us unique. First of all, everything we do at 2Unstoppable under the amazing direction of Stacy is all of our programs are designed to be safe and effective for women, again, any cancer, any stage. We are there to help every woman get started, every class, every program, everything that we offer is through advanced certified cancer exercise specialists. That's all who we work with. Every person on our team has been vetted and has years of experience working with the cancer community. In fact, some of our trainers have had cancer themselves and are also trainers with advanced certification. So that is at the top of what's important in our organization. And again, we are women-centric. So we do work only with women who've had cancer. And again, anytime, any stage. And that is, again, that fosters that sense of community. There is something amazing about other women sharing, supporting each other who are going through the same cancer, the same stage, even different cancers, but they certainly understand the significance of what they've been going through and are amazing supports to each other. Again, as that slide earlier said, cancer can be lonely. Sometimes on the outside, you look totally fine, but to the rest of the world, you appear totally fine, but only somebody else that has kind of been through it kind of understands. So another aspect of our work is that we just don't deliver exercise. Everything we do, we foster a sense of community. And we have been able to build a very strong and supportive community on the virtual platform. So even though everything we do is virtual, which has its amazing benefits because we can support women no matter where they are in the country, and women join our programs from all over the country. But even in the virtual world, we work really hard to infuse that social support, to encourage other women who join our programs, and we help them find ways to stay connected. And you can switch. And then, so I'll just summarize this, but that is really our unique approach, is that we're oncology for women. So much is about that social support, because that's what really helps women stay committed to the exercise, because they have that support. They have a community that is encouraging and motivating them to keep moving.
So we have some answers there in that poll. Excellent that you are all the time referring exercise as treatment. That's amazing. And we appreciate you letting us know what would be helpful to you to help recommend exercise. That's really amazing. We'll leave that up for a moment. In 2Unstoppable, we definitely offer something for every woman. So we have our signature program, one that I will toot my horn for a second. I created it. I'm very proud of it. It is something that is always evolving, because every woman that comes to our program, 2Unstoppable, is different. We are all individuals. Cancer affected everyone in a different way. You had different types of treatment, different types of pharmaceuticals have been used, different types of surgeries. And so the program is designed for each individual woman in a group setting. And we'll talk a little bit more about how we do that, but we do have three different types of cohorts for 2Unstoppable Strong, which is the name of the program. We do a 6-week program for women who are living with metastatic cancer, a 10-week program for women who are 1 to 5 years out of treatment, and a 10-week program in the fall, hopefully, for women who are 5+ years out. So we also are taking time to parse out those 1 to 5 year group, and we're doing one for women who are just about a year out of treatment. So that second bullet point there is incorporating all of those women 1 to 5 years. We find that it's important for that social support that they understand what each other are going through, whether they had different types of cancer, different types of treatment. They were all at one time diagnosed with cancer, and they know that feeling very well, and they understand the burden of doctor's appointments and living their life having been diagnosed with cancer and going through treatment. So it's a very big part of 2Unstoppable Strong is that social aspect, as well as this developed group fitness class for the individual. We have drop-in classes that anyone can join. They are taught by cancer exercise specialists. We offer a strength programming on Tuesday evenings and a really awesome, fun Zumba class on Saturday mornings. Again, taught by cancer exercise specialists. They're going to break down the moves. They're going to help everyone understand what's going on. We have monthly 21-day challenges. We do 21 days because we know that that's how long it takes to form an exercise habit. We also are very cautious to do 5 minutes a day of those exercises. So you're spending about 5 minutes, maybe 7 minutes sometimes, depending on the challenge, getting some determined exercise time in, challenging yourself on an honor system. It's a great way to just get some movement in every day. And they come with form videos. They come with challenge calendar, so you can check it off each day, print it out, and again, all developed within our house of cancer exercise specialists. We offer personal training. So if someone is not interested in that group aspect and wants a little bit more one-on-one, or maybe they're not quite ready for a class, they're still going through treatment, but they know that exercise is important and they want to know how to move, personal training is a great option, as well as an exercise consult, another thing that 2Unstoppable offers. Not sure how to get moving, what is appropriate for them. Are they ready for a class? Should they do personal training? Should they just get out and walk a little bit right now? What's working for them the best? What do they enjoy doing? That's what that exercise consult is for. And then, of course, we have a big WhatsApp community. And this is where we're finding women are communicating things like, hey, I went for a walk today, it felt great, or I just had a treatment, I'm not feeling up for it. And someone else will chime in and say, oh, you should get out and walk, just spend 5 minutes out there, you can get motivated. And then the next thing you know, that woman's coming back and saying, I guess what? I got out there, walked, and I felt great. It's a really good support system. And we do that support through exercise. So a little bit more about that 2Unstoppable Strong program, because it is a program that we piloted in 2020 at the height of the pandemic. The group that piloted for us is still working out together today. So it shows you the strength of the community that these classes build. It's all virtual, so they are meeting virtually on their own time now to repeat the videos that were given during that class time. We meet live once a week during that 6 or 10 week time period. And we are working on progressive evidence-based exercises to really help women feel their best and to understand what their bodies can do. They've been told for so long what they can't do, what they shouldn't do. And now they can discover what they can do. Even if they worked out really hard before their cancer diagnosis, they can now discover new ways to move and work out and get their bodies feeling as good as they did before. We're increasing that range of motion. Everything we've talked about today, we're working a little bit in cardio so that we can get the heart rate up. We are doing flexibility. We are improving mobility. And it's all done in a progressive way, starting with some body weight, moving on to resistance bands, Pilates balls. And we're sending the women equipment to be done with this class. So they don't need to have anything at home but a sturdy chair and a bottle of water and a comfy spot that they can take 2 or 3 steps in either direction. And we are sending them the resistance bands that they need and the Pilates ball that they will want to use for some core work. Again, once again, we are taking into account that individualized experience with cancer and with treatments. So we're meeting with the women and doing a fitness, full fitness assessment, functional movement assessment over Zoom so that we can really understand what's going on with them, how do they move, and we can develop exercises for the class based on the individual woman, again, in that group setting. We are also taking down health and history and requiring a medical release for this program. We did an internal survey a few months back that gave us some amazing results. So this survey was sent out to graduates of the program. We received a really good percentage of them back. A little over half came back with this survey. And the incredible part about it was that, yes, they're still exercising at least 2 to 3 times a week. They're exercising more than 3 times a week. And they are mostly meeting those guidelines, if not more. And then they're doing it when they can do it. I mean, this is just a really good, like, they're still actively doing it, right? We saw almost a 70% increase in strength. We saw the biggest thing that we love so much is almost the 76% improvement in emotional well-being. I mean, that's really incredible when you think about it. They've come together. They didn't maybe exercise before the class. Maybe they didn't have that social support, and here they're feeling good. They're feeling more confident in their bodies. They're feeling like they're in control of their bodies again, and they've connected with other women who get it. And then that almost 70% of feeling inspired to continue on a fitness journey, to continue moving. These are the things that we really, really care about in that program, is like building that strength, building that confidence, and getting them to continue to exercise. Part of that 2Unstoppable Strong program is that we want to work with you to be the program that you refer your patients to. And a part of that is maybe creating your own cohort of women that are in your hospital or cancer center. This creates a community within your group of patients, and it allows you to really be that person that said, not only am I going to tell you you should exercise, but here's a program where you can receive social support of women that live right around you, are within your medical team, and you're going to get a program that's designed just for you. It shows your patients that you really do care about what happens to them when they walk out that door of the clinic. And so, and they know you do, but it just really makes it like, oh, wow, they even gave me a path to do it. And they formed a group of women that are also seeing my medical team. And I can maybe meet my neighbor who sees them and I didn't even know about it, and go on a walk with my neighbor. That's happened. We had a partnership with a hospital system in Baltimore, and two women, they were 2 doors away from each other and did not know that each other had gone through a breast cancer diagnosis and treatment, and they now go for regular walks together. So this is creating a different kind of community, one that is enhancing the health of your patients. So this is a little bit about how you can become partners with us. We are happy to send you this as a PDF as well. If you are not the person that makes the decisions about partnerships but need to pass it on to someone, we are able to send this to you electronically as well. It's a pretty simple process, and it just really completes all of your offerings. As a part of that process, this is what we bring to the table. We bring that functional movement, not only expertise of cancer exercise specialists designing this program, but that functional movement piece, that requiring of the medical release form and that health and history form, so we have a true understanding of your patients. And our main mission always is to do no harm, but to bring that joy through exercise, right? So that functional movement, very important, so we can really understand what's going on with them. We're going to provide that at the start of the program. We're going to send those resistance balls, Pilates ball, and while we meet live once a week, we record that class. And that class goes into a secure Dropbox that is only for that particular class. And we also include a walking plan. So they're getting the videos of all the classes so that they can get that 2 times a week at least of strength training in. Maybe, hopefully they go for 3. That would be amazing. And then they also have a plan to walk, and understanding how they can add time to their walk. They can add that brisk pace and increase that heart rate. Again, a fun, safe, evidence-based program taught by cancer exercise specialists. I mean, my team of instructors have been doing this for a long time. We're ready to accept those challenges and to learn more from the women that are coming into the program and adjust our plans based on them. And that social connection and support piece is so important. Again, creating that cohort, allowing your patients to feel comfortable within a setting that you have helped create as well. Ilana, anything to add?
Um, I was maybe just going to add if you're, as Stacy said, if you're maybe not the person within your organization who can maybe, inquire about forming a partnership, we hope you will at least maybe be the champion. And we're happy to send you flyers of our 2Unstoppable Strong program. We're in a partnership document that kind of outlines in more detail what a partnership with 2Unstoppable looks like, and be that champion to help bring this program to your hospital or cancer support center. We have worked with a number of hospitals already. We have a few other partnerships in process. And it's really a great way to help your patients start to exercise in a evidence-based, safe, and effective manner. So hoping all you need is one champion within the hospital to kind of help bring this program.
And it's really important to know that as we said, we've been doing this program since 2020. So instead of trying to reinvent the wheel and start a new program, just bring it to us, because it's basically, we can just deliver it for you and you don't have to go through the trouble of trying to find a program, start a program. We have that ready to go. So just a few testimonials from women that have gone through our program. I love the bottom. I love them all, but I love the bottom. Misha was just amazed that she could go from doing nothing to doing a 45-minute class. I taught her, I remember her very, very well. She's still a part of our organization and is helping us tremendously as an ambassador to the program, someone who's like really pulling the women together. But she really had not been exercising and wanted to so badly, and was so afraid that she was not going to be able to last the 45 minutes. But she did. I mean, incredibly, the first class, she was like, wow, that was not so bad. And she really enjoyed it. So, I mean, giving confidence and empowering people to exercise, her thinking of their body as an enemy and not being able to explain that to a trainer, but not having to worry about that within 2U Strong and 2Unstoppable. I mean, being inspired to motivate and move more. You can look at this one that I was stuck in a cycle of being afraid to exercise, afraid to get hurt. And that kept Kathy from being consistent with movement. When she joined 2Unstoppable, she did have a lot of issues going on. And she is still one of those people from our early program who is still exercising. So, like this, I was active before diagnosis. We see this a lot. People who were seeing trainers, they were in the gym, they were running, they were biking, they were doing everything they could to just be active because they enjoyed it. But then they were left really unmotivated. And then they got back to exercise with us and figured out a new way to do it, and understanding what was happening within their bodies and how to utilize that to exercise. So these are all really amazing testimonials. We have many, many more. We picked out a few that we thought would go along with this. Our women that come through this program, each and every one of them is the most unbelievable person you will ever meet, the most amazing person that you'll ever meet. And I'm sure that you feel that as well when you are working with your patients in the hospital. You just know that there are amazing humans out there who are ready to move with you. And we are at our question slide. Any questions in that Q&A, Charlene?
Not right now.
If there are any questions, feel free to drop it in that Q&A. We also can allow you to ask that question verbally if you'd like to. You just need to show us an emoji, raise your hand. We're happy to answer any questions about anything we talked about today. Review back to some slides if you need it. This recording will also be found on our YouTube channel later today and sent out to anyone that registered for the program. do feel free to ask any questions. If you don't feel comfortable asking them now, or you have time to process everything we talked about today and then have some questions or comments, please do feel free to email us. Our emails are there on the screen. It's very easy. It's our names at 2unstoppable.org.
And we're also happy to provide a webinar for your patients, if it's for members of your team, if you wanted us to more formally introduce ourselves to your organization, we're also happy to do that. So just reach out to either Stacy or myself, if we can help you talk about 2Unstoppable within your hospital.
Yeah, whether that's to talk about a partnership with the appropriate people just on a Zoom meeting, or as Ilana said, we have done many educational webinars and we are very happy to do that. It's a piece that we care a lot about, not just the exercise piece, but educating women on why they should exercise. So if you do need some assistance with that, we're happy to do that. Maybe you even think about broadcasting one into an infusion center or into your clinic if you would like. Well, we thank you very much for joining us today. And again, if you have any additional questions or comments, please do send us an email. We are very good about responding to emails. And at any time we are available to chat with you. So feel free to reach out to 2Unstoppable, visit our website at 2unstoppable.org, and you'll find out a lot of the information that we talked about today in regards to our programming. And if we can send you any electronic flyers from today's webinar or about partnerships, we are happy to do so. I want to really thank Charlene for sitting in the background, monitoring all of these things in that chat. And Ilana, of course, we are all working together. The three of us work together as a great team, and we've been happy to be here with you today.
Thank you, everybody.
Have a great day.